Hello and welcome to YouTube channel HealthQ, the place where my mission is to motivate you and help you to move on to the brighter side of the health. This is physiotherapist Meghna Dave, and in today's video I'm going to talk about fibromyalgia, one such condition which is a psychosomatic disorder, a movement related disorder which impacts quality of life drastically. So what exactly is this problem? What are the symptoms, why it happens, and how it can be managed? We are going to discuss all of that in today's video, so make sure to watch this video till the end. Let's begin. Friends, fibromyalgia is a psychosomatic disorder and a musculoskeletal disorder, which means that due to psychological impairments as well as due to musculoskeletal problem, person repeatedly experiences musculoskeletal pain in different areas of the body. This is a chronic problem, and that's why it takes a very long period of time for a person to get out of it. Technically speaking, there is no cure for this problem, and that's why there are many people who suffer from it for a lifelong time. Many a times this condition is not diagnosed well, and person tries different treatment methods, different techniques, don't find a solution, and eventually gives up with living a painful life. That's why identifying it, knowing what exactly it is, plays a very crucial role so that a person who suffers from it can be helped. So let me explain you what a person who suffers from fibromyalgia will go through. So fibromyalgia, as I said, is a psychosomatic disorder, which means whenever there are some triggers like stress, anxiety, fatigue, depression, increase in level of physical activity, or etc., some other unique factors that is very unique to that patient, but whenever these triggers are there, person will experience pain, fatigue, tenderness in muscular region. Commonly this muscular area is neck, upper back region, lower back region, axillary region, in the thighs, around the neck, around the knee joint, and in calf region as well. These points keep on varying and there is no typical area. And one important differentiating factor is if we check the X-ray of this person, rarely there would not be any related pathology seen in X-ray or scans compared to the symptoms that a person shows. A person who suffers from fibromyalgia can have some other disorders as well, but that does not mean that a person who suffers from spondylitis or any sort of musculoskeletal disorder will also suffer from fibromyalgia. Fibromyalgia is a chronic problem usually elevated by a trigger and not by a pathology in itself. What we have found out is that a person who suffers from fibromyalgia has an altered level of processing of pain receptors or pain sensation at brain level, due to which he or she experiences the symptoms. If we look at who are the people who experiences this fibromyalgia, we have clearly seen that women are more susceptible to develop fibromyalgia compared to men. The common age group of women who suffer from fibromyalgia is 20 to 55 years, but that does not mean that men don't suffer from it. But yes, women are more prone to develop it. Some common reasons which have been found out that why women are more susceptible to develop fibromyalgia is the fact of their behavioral pattern. Women mostly are susceptible to practice maladaptive stress coping mechanisms. Women have higher level of depression and anxieties compared to men. They undergo different hormonal changes that impair or else impact their ability to cope up with stress, and that's why they are more prone to develop fibromyalgia symptoms. If we look at the pathophysiology, like what exactly happens in fibromyalgia, what has been shown is that the problem is in brain and brain's ability to process pain. Person is usually hypersensitive to pain perception. There is always a higher level of excitatory neurotransmitters found in brain, which are glutamate and substance P. There is decreased level of serotonin and norepinephrine in the descending neuronal pathways, which are anti-nociceptive, or else you can say are natural painkillers in our body. Even person who suffer from fibromyalgia have reduced level of dopamine release in the body, which means the happy hormone that we have in our body is released at lesser quantity in people who suffer from fibromyalgia, and that's why they are more prone or is more sensitive to pain sensation. And as the time passes by, As the pain comes again and again and again, the brain becomes more and more sensitive to the pain sensation, and that's why even a smaller quantity or a smaller amount of pain feels very big or very high in intensity for a person who suffers from fibromyalgia. Also, there is alteration in the level of internal opioids that are present in the body, and these all pathologies leads to symptoms of fibromyalgia in a person. If you come to the diagnosis part, usually there are some conditions which mimic this problem, so it's important that you should go to a doctor and check with him, tell your symptoms, your history in a very precise manner. Then doctor would be able to differentially diagnose this. Remember, a person who suffers from fibromyalgia can have other musculoskeletal disorders like spondylitis, lumbar spondylitis, cervical spondylitis, or else even knee issues, etc. But it is not necessary that every condition, pathological condition of musculoskeletal system, or as a person who develops these kind of musculoskeletal issues will also have fibromyalgia. So these two are different things but can coexist. So that's why differential diagnosis plays a very key role. Usually one of the important aspect of differential diagnosis is lack of presence of significant pathological signs in the scans that we do, and that should, or else they are not correlating with the symptoms that a person is showing. Even the history and the symptoms that patient gives or patient says does not match with the pathologies that is shown or seen in the x-rays or scans. That is one key factor to differentiate. Second, the triggers increase the symptom. This is also a very typical sign for a doctor or else a therapist to identify whether the person is suffering from fibromyalgia or not. And third, but not the least, is gradually the sensitivity of the pain is getting affected for the person, and person is getting more irritated, anxious, and is developing psychosomatic disorders or psychological issues related to this pain. These are some typical signs of fibromyalgia that we have to consider when a person suffers from this problem. Now coming to the management, unfortunately there is no permanent cure to this problem in medical sciences. There is no surgery for it, there is no typical medicine to cure it. This has to be treated in a holistic manner where multidisciplinary team of people helps to solve that problem at an individual level. That's the reason physiotherapists, doctors, orthopedic surgeons, psychotherapist or psychologist, psychiatrist work together to help this patient overcome the problem. When it comes to physiotherapy, the focus is more on developing good postural habits to strengthen the muscles, to improve the flexibility of the muscles. At the same time, psychological counseling and education plays a very crucial role, because patient needs to be educated about the problem so that patient gets awareness about it and patient can learn different coping mechanism. Along with patient, family also needs to be counseled, because gradually the family starts becoming unempathetic towards patients, which worsens the situation for them. That's why education and counseling plays a very crucial role. And some alter or different therapies like yoga therapy, aromatherapy, music therapy also helps here tremendously. Even dietary modification helps a person to deal with some extra symptoms that comes along with fibromyalgia. So that's what is the role of management in fibromyalgia. And through this video, I tried to give you a brief about it. I hope you found this video helpful. If you want to know more about fibromyalgia, you can reach out to us. We have shared our details of contact in the description box below. We have our website as well as our app where you can take expert consultations to deal with your fibromyalgia problem. So on that note, I'll end this video here and I'll see you in another video. Thank you.